Hey guys, it's Dr. Jamie here. I take my mask off. I know a lot of you guys are wearing masks as you go out, and every establishment that we go in. I just finished a shift here at Extraordinary Life Chiropractic, and I wore my surgical mask. You're gonna end up with a lot of pressure from wearing these, and maybe you're already experiencing this. So you've got the pressure, you're wrapping these around. There's different types. So you got these wrapped around the ears, covering the nose and mouth, or you've got the ones that, they wrap around high and then they wrap around low. And we're already seeing people in the practice come in with more headaches, with more neck pain, and there's no doubt that it can be related to the masks. And you might think, well, how does this relate to a mask? How can, this light pressure have such a dramatic effect? And just think about, even a postural change. If you're sitting and you're in a bad posture, it only takes, a couple hours, not even, before you start feeling aches or pains or tension. And the same is true. And, when you're using the masks, the fit is really creating not just pressure, but it's very focal pressure. So it's, it's pressing on a very specific area. And so I want to give you 3 things that you can do when you take your mask off that can help at least reduce the chances of you getting headaches, neck pain, irritation, and dealing with a lot of the effects that might come from this. So let's get into it. Number 1, when you take the mask off, what I want you to do is I simply want you to give yourself a bit of a massage. Now, everybody likes a bit of a massage, and maybe you have a partner, spouse, they can help you out and give you a bit of a massage. There's a prescription for your partner or spouse. Doctor's orders, you need a massage after you finish with your mask. Now, the reason we do that is, sure, releasing muscle tension, I think that's fantastic, but one of the things that happens when you have these strings and they're putting focal attention is it affects the nervous system in a way that really heightens the sensitivity, and you're probably already experiencing this. So one of the ways to bypass that is to start to touch more areas on your face. So you can give yourself a massage in the facial muscles. You can go ahead, the muscles across the back of the neck. You can go ahead, even across the head, across the temporalis, which is high up here. Just give yourself a massage and start to give and create more touch points, which will diffuse and really decrease the amount of sensitivity. So that's number 1. Number 2 is range of motion. Really simple thing you can do, cervical spine range of motion. So what are we gonna do? We're gonna look to one side, look to the other, do that a couple times on both sides, stretch to the side, okay, back and forth, down, and up, down, and up. Right? That's a fantastic way to just help, again, release some of that tension from wearing these guys all day, every day. And then the third one is start to use something that can give you more specific contact. So in our practice, we use a lacrosse ball. And if anybody's trained in a gym like the Fit Club or otherwise, they may use something similar. You could use a golf ball or maybe even a softball. And you're gonna take that and you're going to give yourself more of a self-massage, but it's gonna give you a bit more pressure. And I want you to focus specifically on the muscles across the ridge of the neck, okay, way up high. These are the upper cervical muscles, and these are the ones that are gonna become very, very sensitive. So we're gonna take that ball and we can massage it in there, okay, all the way across the top on the ridge. You'll probably notice some sensitivity in the shoulder blades right on top where these muscles in the neck come down and they attach. A lot of people think they have a shoulder problem when you feel that tension building here. It's not a shoulder problem. Most times it's actually a neck problem. And because of the way the muscles are set up, these are the guy wires. So if the head starts to shift forward, you can see these muscles get longer and tighter as the body responds and tries to pull those back in. So 3 things, if you're wearing any kind of mask, right, whatever your mask is, to help reduce the chance of getting headaches, neck pain, and otherwise. So what are they? Number 1, self-massage, right? So stimulate different points along there that help diffuse the attention away from having a very focal contact with the string. Number 2, range of motion, all different range of motions. And then number 3, use a lacrosse ball, a golf ball, or some hard, ball that's gonna be able to get in deeper into the musculature across the ridge of the upper spine. So I hope that helps you with the masks. And until next time, make it a great day.